was fortunate to be on the IOM committee that put out the recent PAINWeek and one of the messages that we called for
all these things
was an increase
combined
in the amount
probably
of
contribute
education.
that
We
pain
education pain education. We have 116 million Americans suffering from chronic pain. We have only several thousand pain specialists. If you do that math, it works out to about 30 to 40,000 patients per pain specialist in America. There's simply not enough to go around.
Americans face a healthcare crisis that goes virtually unnoticed every day.
So one of the things that became clear from the Institute of Medicine report is that pain is among the most expensive and most prevalent public health conditions in the United States.
The failure to relieve chronic pain leaves far too many people suffering needlessly and wishing for relief by any means possible, including suicide.
So many pain patients feel so terrible in their skin all the time that they can be extremely nihilistic about making behavior changes. And we really do wrestle with trying to move those patients from point A to point B.
There have been a myriad of challenges confronting pain management clinicians over the last 2 decades.
Primary care physicians are out on the front lines. They're the ones who are seeing these patients first. We, as pain specialists, need to do a better job in communicating these topics of pain education to them. And it needs to start not after they've graduated from medical school and are in their training. That's a critical point. But we really need to start this in the medical school also.
What has emerged from the rubble is that education is no longer a choice, it is a mandate. It will be education that reverses misuse, abuse, and diversion among patients and poor prescribing habits among clinicians.
Another issue would be just a basic issue and a basic question that hasn't been asked, and that is, how do you define abuse, misuse, diversion, and overdose deaths?
It will be education to the frontline practitioners of the world that yields greater therapeutic options and thus better patient outcomes.
I think PAINWeek comes in and delivers a very important message, especially to the primary care population, who are typically the frontline clinicians who hear that first complaint of pain and are the first to try to address it.
Why is PAINWeek the largest U.S. pain conference?